What's going on, everybody? It's your girl, Sharí Nycole. Welcome to season 4 of Just a Thought with Sharí Nycole. And as you know or may not know, I'm on location this season. And today I'm at Prevent Clinic. It is owned and operated by the one and only Dr. Dave Montgomery. He's actually my cardiologist, but one of the most brilliant minds and doctors, I say, and I know, not only in the nation, but in the world. We're gonna chat about all these cardiac arrest cases that have been going on, conspiracy theories, COVID-19 vaccine, heart health, you name it, I'm gonna ask the question. So he's one of the most amazing personalities as well. I'm sure we'll share some laughs and much more. So hang out with us for a little bit, all right? Season 4, let's go.
It's just a thought, it's just a thought, just my opinion. It's just a thought, it's just a thought. Get out your feelings, it's just a thought, it's just a thought. It's my opinion, it's just a thought, it's just a thought. Get out your feelings, it's just a thought, it's just a thought. It's my opinion, it's just a thought, it's just a thought. Get out your feelings, it's just a thought, it's just a thought. It's my opinion, it's just a thought, it's just a thought. Get out your feelings.
We finally made it happen. I reference Dr. Dave Montgomery as one of the most amazing medical professionals, doctors, cardiologists, literally in the world. This is what I say all the time when I talk about you. So thank you for fitting me into your schedule.
No, I'm so glad. I'm really pleased that we get a chance to actually do this.
Yes.
I've watched you from afar. And I'm like, I'm so proud of my girl.
Oh, Dr. Dave.
Here you are, 4. This is season 4?
Yes, this is season 4.
4 seasons in. And when you know, I've seen you work behind the camera. When I see you in front of the camera, I'm like, it's about time.
It's my first love, Dr. Dave.
And I'm just happy. I'm just glad you invited me. This is dope for me. It really is.
So, Dr. Dave, before we get started, I'm going to explain to everybody. So, I had a wardrobe malfunction coming in here. And Dr. Dave told me, go ahead with the one strap on the people. Just do the
Give
one
me some
strap.
comments. Hit that comment and tell me that looks great.
So I get fashion advice from Dr. Dave.
Boom. Listen.
He's my cardiologist.
Full service.
I got all the stuff here.
Full service. One stop.
So Dr. Dave, one of the reasons why I wanted to chat with you, I text you as soon as Bronny James, all the headlines about cardiac arrest with him came about. I said, okay, I need to get with Dr. Dave.
Yeah.
Because obviously when these things happen, a lot of the conspiracy theorists come out of the shadows and give their take on what's going on. For you, it's not only Bronny, you know, Damar Hamlin, last year, other young athletes going through the same issue.
That's right.
What are some of the fallacies and what are some of the realities?
Well, I mean, I think the first thing that comes up, especially lately, is that this was all about some vaccine.
Yes.
You know, it was a COVID. First of all, we don't know if Bronny had a vaccine, right? You don't know any of that. You don't know what the timing is.
Yeah.
I will tell you that I was a little bit skeptical myself. I didn't really, without the information, I didn't know if he actually had a cardiac arrest, right? The heart stopped.
Yes.
Or did he, for example, faint on the court? Right. There's a number of different things, right? So if he fainted on the court and somebody went to go check his pulse, if you don't take a pulse for long enough and somebody who's fainted, the heart slows down when you faint. It can seem like there's no pulse. You hurry up, you start doing chest compressions. So, you know, I was going through the machinations too, like everybody else. So I'm not going to try to make it seem like, oh, I'm holier than thou. I know all this stuff.
Yeah.
I was a bit skeptical. But now we hear from the family. We haven't heard from the physicians, right? The family didn't give the physicians permission. We heard from the family that he did have an arrest and that they found something that was treatable and that Bronny was going to come back in the near future, which was the statement. So as a cardiologist, I'm trying to think, well, what are the things that you can fix like that and have somebody go back into play? And there are not that many, right? So time will tell.
It's tough for me because one of the things I wanted to ask you is the realities around when players, or if they should at all, come back on the field or on the court, Damar Hamlin, for instance, after they have this serious issue take place. Because I always get nervous. Like when it seemed that Damar Hamlin was getting back on that field, I honestly was saying to myself, okay, why? It almost sounds like you're just playing Russian roulette with your life at that point.
Yeah. But I get it from his standpoint.
Yeah.
It is the love of his life.
Yeah. Yeah.
People are willing to give their lives for the love of their life.
Yeah.
So for him, it's a different calculus. But for the physicians and the league and the teams, oh, it's hard.
Yeah.
I'm going to say this quick kind of commercial break. I feel like the NFL now is leading the pack. This is how we respond to challenges like this. Now they've got people ready. Every game is ready. Every game has a pre-huddle of, emergency medical teams. They know what to do if something happens. They huddle like the teams huddle. Got it. Yeah. Okay. With that being said, do you really want anything like that to happen to Damar Hamlin again? So when I was interviewed on multiple networks around this, the question always came, do you think he should ever come back? And it really just depends on what we think happened.
Right.
I disagreed
with... Which we still don't
know. And I think I have kind of this, I'm over here with the theory, and we can go through that another time, but I've talked about it over and over again. I do not think that he had commotio cordis. I do not think that. If it were commotio cordis, everybody who saw that film, from commentators to physicians to people who don't know anything about sports, says, he didn't get hit that hard. If he didn't get that hard and went into commotio cordis, what would happen if he gets just a slightly harder hit at the very wrong time, right? That's what happens. Commotio cordis is you get hit in the chest at the very wrong time in what we call the cardiac cycle, the lub-dub. It's about to beat again. If you get hit in a certain time, it's very sensitive and it can make you go into one of these rhythms, heart rhythms, that's fatal, right? Gotcha. But it wasn't that hard. So, okay, you say, well, it's commotio cordis. I disagree with that. It's commotio cordis. What if he gets another commotio cordis? We would be devastated.
Yes.
Look, I love sports too. I want to see him play.
Right.
But I don't want him to die.
Right.
And if it's commotio cordis, it just makes it, more likely that it can happen again. If it's what I think it is, which is that the blow to his chin, and I looked at it from as many angles as I could get my hands on, I believe that the blow to his chin caused a kind of concussion. And he had a traumatic cardiac arrest. Not unheard of, right? Look at the blow. Did he get really hit here with the spear of his head?
No, he didn't.
He went up and into his jaw. There is nothing down there. He went up into his jaw. He stood up.
Yes, he did.
Now, let me just tell you something. If your heart stops, commotio cordis, boom, when it hits you, your heart stops immediately from beating, immediately. He stood up.
Yes, he did.
Moved his helmet and then went back. Now, think about this. Here's another one. He went back without putting his arms down to protect himself and popped his head again on the ground. Concussion number 1. Concussion number 2. Rattles the brain. When he was down there, watch the film. He was moving his leg. He moved his leg. The trainer didn't move his leg. He moved his leg. It was only after a period of time that they said he doesn't have a pulse and brought out the ambulance and all that stuff. Commotio cordis does not have time for you. It's not about to wait for you to get it all together. When commotio cordis hits, your heart stops immediately. You can't move your leg if your heart stops. You can't move anything. You're unconscious. You see what I'm saying?
Yeah.
So if it was a concussion, should he play again? Because the concussion caused a traumatic cardiac arrest, right? Such a, and the mechanism by that is probably that you get a surge of adrenaline, and the adrenaline causes you to go into this, right? If you think about what happens to people when they have big traumatic things like a car accident or, falling out of a window or something like that, your heart stops because of the trauma.
Yeah.
And so I don't think he should go back on either of those.
Yeah. It makes me think about when you start putting money into the equation, you start talking about financing football or financing basketball. I feel like the risk is heightened even more in terms of players coming back when they shouldn't. Yeah. But off that note a bit, I want to talk about just physicals for these athletes, especially high school athletes.
Yeah.
Do you feel like, which is interesting for me, I mean, as a former athlete, I thought my physicals were pretty thorough.
Yeah.
But do you feel like we're missing the mark in high school and collegiate sports with the physicals?
Absolutely. And I want to get this right. So, we are not seeing more of these arrests. We had some pretty high profile ones. DeMar Hamlin, Bronny James. In sports, you don't get much higher profile than that. And so it just seems like there's a lot. But I put a little post on Instagram about, hey, they're about a quarter of the athletes are women. These are females that are having them. Across sports, the last one that I saw on the list, they keep a kind of a tally, was a cheerleader. Wow. You compete as some of these cheerleaders now. I mean, that's a real sport, right? The way that they train. We're not seeing more of them. And that's a good thing. We're not seeing more athletes having cardiac arrest in the field of play. So that's really good. But I don't think we do enough to prevent the ones that we can't prevent. Mm-hmm. You cannot prevent all of them. But there are some that you can. Yeah. And if Bronny James went in and they said, hey, we found it and it's fixable, what if he had the exam that they did post before? It may have prevented it from happening in the first place.
Absolutely.
He just got really lucky that somebody was ready to go, right? If he had a cardiac arrest at all, ready to go, did the CPR, did whatever was necessary, had the AED. We should be doing a comprehensive cardiovascular physical, and testing. The testing that I do every day. So for a very long time, the Americans have said it's not cost effective. And it just...
There goes the finance piece again.
But that's why. And at the end of the day, they're talking about the costs that come from doing tests in people whom your original screen says something's wrong. So we find something wrong, you got to do some more tests. And sometimes you find out that the original test that said something was wrong was not right. We call it a false positive. Mm-hmm. Let's be parents. Let's say you're taking your child to a screen and there is some signal that something's wrong. Mm-hmm. I don't really care if he has to go through more tests. Absolutely. And the test showed that there's nothing wrong, because then I would be relieved, and whatever little stinking money you think it took to get that information, great. But not all of the positives are false positives. So we're so protecting of the false positives because our original tests should be improved. They're not that good. Yeah. Well, that's what we should be focused on. But we should do a full, not just a physical and history, which are critical, but literally look into the person's heart with an echocardiogram, an ultrasound, with a stress test, with EKGs. Yeah. Going beyond what you can tell from a history, because there are things that people have and they're the first person to have it in their family. Yeah. So you're not going to get it from a family history. And until we just decide that that's important enough to do, maybe not for every person who ever plays sports in life, but for our young, highly competitive collegiate level or aspiring collegiate level and professional level athletes across sport. Basketball is not a high impact sport.
No, it's not. No, it's not.
Okay, so that's what I think.
I want to ask you about transparency for a moment.
Yeah.
For the high profile athletes like a Bronny James, like a DeMar Hamlin. Yeah. I personally feel like there's information that's being left out. Now, I don't necessarily feel like I'm owed that, but do you feel like to some degree there's a concerted effort to keep some of the intricacies of what happened and what's going on private for a real reason? Yeah, no, I understand. I don't know what all of the reasons are, but I do understand if I just zoom out a little bit. First of all, it's a HIPAA violation, right? That's my medical history. Like, I don't want you to know all of that stuff, okay? Yeah. So just from a choice standpoint and not violating people's like that's liberties, like don't do that. But also that there are some nuances. We've already kind of mentioned it a little bit. We talked about it a little bit, how people can get just a little bit of information and then they go spiraling off on something that has no fact base whatsoever. Like, you can't even contrive that in, like AI. I mean, I don't even know what people sometimes. But so I get that. And I also get how it's important to allow leagues to sort things out, figure things out,
I do think that the people who make those decisions have a responsibility to get out there first. I don't believe that you should be sitting back for too long and not giving information. I think that's what happened in my profession with COVID-19. We let, I don't know who, usurp the narrative.
Yeah.
And when they usurped the narrative, we never went back to get it. It's like somebody did the interception. You don't even play defense on the next play. Like, you just let them go score. Hell, I mean, that's the end of the game. No, you don't do that.
Yeah.
You go back and get the narrative again, right? So I believe that leagues, all of them, where this is happening, you should be stepping out and saying, hey, look, these are the things that we're doing.
Right.
In this particular situation, we can't get into too much more of it. We're not privy to do that.
Right.
Here's the things that we're doing. If they would get out right now and tell us what they're doing, and I did hear some stuff today, so about the NFL.
Yeah.
So the NFL says, this is how we're going to respond. Now I want to see the NBA do it, and soccer and baseball. I want everybody to do it. But I understand why we are not privy to all of that information.
Yeah. This is very fascinating to me. Because I get it.
Yeah.
But also, another thing that you teased a little bit, and that, again, we kind of touched on in the beginning, is the conspiracy theory piece.
Yeah.
How has that been impacting you as a doctor, and possibly some of your colleagues as well?
Well, so, I mean, for me, I just, my influence is different, right? And I sit down in these rooms and I think I garner a little bit more respect from somebody who's just talking out of the side of his or her neck. But I also, I just am effective with that. I'm not trying to sound hoity-toity or whatever, but so the conspiracy theories get doused in water when they come in here, right? So I'm able to show them what I'm talking about. Don't just tell me, doc, show me. So I've got screens. I'll pull up screens. I'll show you exactly what I'm talking about. And then I'll tell you, go back and read about it. I always challenge my patients to whatever you think is true, whatever you're saying is true, go ask yourself, how do I know that this is true? If you go and you just search certain things in Google, Google knows what you want to hear and it's going to give it to you. We call it confirmation bias. That's the algorithm. It's going to do that. I give people other things to read to challenge maybe what they're saying, especially if there's not enough evidence to support it.
Yeah.
But quietly, your boy is a conspiracy theorist.
Really?
So here's the real jam, okay? So if you think you're gonna come into my office and be a conspiracy theorist,
you already figured something. You already conspiracy
you better come with
yourself
it.
down.
You better come with. You know what I'm saying? So what I am not is going to just take something that doesn't even seem like it belongs in the universe.
Right.
You can't. We're not shape-shifting and stuff yet. That's Transformers. We can't do that. So if you get something that's plausible, I am front and center. And so that's the problem, right? So you come in here and it's like, what? That is garbage. So we have a little bit of fun. It's that I'm late. I'm 30 minutes late for the next patient because I'm talking to this guy. But I get it from kind of this fantastical world over here, but it's got to make sense to the scientist in me too. So, and that's where I think the exchange comes. There are so many different reasons. The last point I'll say on this, there's so many reasons why people go off on these.
Yeah.
And what I know for sure, and although I kind of poked a little bit of fun, what I know for sure is nobody is saying all of this stuff because they're trying to mislead.
Right.
People who are, most of the people who are saying this have their perception has been changed by something. Their perspective has been changed. And many of the times, if you get deep enough, you're like, man, that happened to your family? That happened to you? Literally, what happened to you? Oprah Winfrey, like, what happened to you?
Yeah.
And so it's so easy on social media to be like, oh, that's crazy. And, names, expletive, blah, 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 right?
Yeah.
I see the world a little bit differently because I take the time to feel people. I remember when I realized I became a true physician when I stopped seeing patients and started feeling patients. If you feel where people are coming from, you find out that something in them is hurting or there's a gap or there's a void and that's what's coming from them. So I get it all around, but it can be totally misleading to folks when you start spreading it and it has no semblance of like reality, none.
What semblance of reality do we have when we talk about the COVID-19 vaccine and cardiac arrest in particular, how it affects the heart?
Yeah.
What do we know? What are we hearing that's not true? What are we hearing that has some level of truth to it?
Yeah, I think the scariest part was in 2020 when we first started seeing, remember, we didn't know anything about COVID-19 in 19.
Yeah.
We first started hearing, I remember in the beginning of the summer, May, when we started seeing the research come out and say, people who had just a regular run-of-the-mill COVID-19, 2 weeks of whatever, cough, fatigue, whatever, could have cardiac involvement. And we had no idea why. There was a study that showed an MRI. You stayed home, you didn't go to the hospital. You had a normal kind of course. Went back to work, had an MRI, and the signs that COVID-19 had affected your heart are very clear on the MRI. It wasn't just adolescent boys, but it was mostly adolescent boys. So we knew from that point that there was something about our physiology vis-a-vis the physiology of COVID-19, the virus itself. And now we understand what that is. It's the way the virus gets into cells, the way it gets at the gate, the door, the receptor that allows COVID into the cells, lives a lot on the heart. There's a lot of these receptors on the heart. There's a lot of the receptors in the lungs. Those are the two places when we first started seeing alpha, delta, and all these other aggressive variants.
Wow.
So we kind of understand why. So we know straight up that the immune system's response to COVID-19 of any virus in your heart is going to be aggressive. That's where we're seeing the myocarditis. We didn't see a vaccine until 2021.
That's true.
The evidence that your body was going to smash COVID, right, as best it could, and that's where most of the symptoms come from. Most of the symptoms didn't come from the virus getting into the lungs. It came from your immune system's response to it.
Wow.
Right? Right? And so now we're learning a lot about this stuff. Enter the vaccine. Now, and I put a bunch of stuff out about the vaccine. Oh, this is new. Oh, they just made this last week. And I'm a scientist. I was a scientist. I tell people this all the time. I was a scientist before I became a cardiologist. So I understand how much research goes into even very small things that you and I can talk about in the lay press. I went back and I showed on this little video where mRNA vaccine has been studied for decades, like literally decades. We've been trying to understand the SARS family of viruses since the first really aggressive one, right, in the Middle East. And then it came to a head, and thank goodness we were far enough along to put the things together and get the vaccine out. What we also found was we don't have to take that long to do research trials. Like, y'all are taking too long. What's the red tape for? What's the bureaucracy for? I get why that is, right? Somebody's job depends on it.
Yeah.
But then the optics are, y'all just hurried up and made this a DIY kind of, you just put the video up, let's go find this, the DIY vaccine.
Yeah.
And it is insulting to the scientists who literally have spent their careers trying to figure out mRNA and how quickly we can change an mRNA vaccine. But I get it. Guess who didn't say that to people? Guess who didn't say it just like I said it to you with a little bit more time? We didn't say it. Science, biomedical science in the United States did not say that to the American people.
Why?
I have no idea. I cannot figure it out. We have enough communicators that can explain stuff. For a long time, I was saying that the messenger matters. The messengers that we had at the time weren't getting out to enough people, but I don't think that the message was this message. If you coach me along and you tell me what's going on, and you tell me when you made a mistake, this one. When you made a mistake, and tell me how you made a mistake, and now that you're better, and here's how you're better. And all the impropriety, it goes away. Tell me what's going on, but we didn't do that. Let me just give you this, and you'll like the story. So I remember January 2021. Remember, I used to come to Sister Circle regularly.
Yes, you did.
Okay.
Yes, you did.
So this the question of masks came out. Should we be wearing a mask, Dr. Dave? Anthony Fauci had just come out and says, listen, hey, let's save the mask for the medical professionals. Let's not use masks right now. There's no evidence that the masks work. I'm listening to that. Okay, da-da-da. Write my little answers. Okay, I'm ready to go. Okay, if they ask me about this, I'm going to be ready to go. They asked me on Sister Circle. Selena Johnson or something.
Yes,
like Rashawn Ali, somebody.
We definitely asked you about masks and vaccines every time you came.
Guess what Dave Montgomery said?
What Dave Montgomery said?
Oh, no. Let's leave the mask for the medical professionals. Let me just tell you something. I'll give you a little back. When I was listening to that, I was saying to myself, this doesn't make sense. I was so used to towing a line and regurgitating information that I discredited and therefore short-circuited my own pathway to what seemed true. I am a bona fide scientist. No, come on. Like, I earned it too.
Right.
And my process of going through the scientific method, I think is pretty good. It got me to where I am.
Absolutely.
But I didn't listen to my scientific sixth sense. Once it was clear that that was the very wrong thing, I started contemplating, you got to stop doing that, Dave. You got to stop just saying it because somebody else with authority said it. And I remember when the pediatric thing came out and we were asking the question, what about kids?
Yeah.
Because we wanted to open the schools back. I understand it. I get it. And they were saying, well, kids don't really get it. Well, let's just stop for a second. You don't have to be a scientist. Well, that doesn't make sense. Right. That don't make sense. What kind of force field does the kid have?
The adults don't
around. Do they have some kind of thing? Y'all show me. Like I said, I'm a conspiracy
theorist. And kids stay with a cold. They stay sick all the time.
Tell me why they would have. Very shortly after that, we started to see not only can kids get it, they wait to develop MISC, right? Remember that? Multiple system inflammatory syndrome in children, kids sitting in ICUs. I remember when I went against that on social media, and one of my pediatrician friends was like, Dave, I can't believe you went against that. Kids do not get it, blah, 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 blah. We started seeing the kids, and I said to her, okay. Okay. It didn't make sense. So I had to say to myself, I'm not going to just toe a line just because somebody who has authority said it. It didn't make sense to me. And when I started to stick to that, I felt like that's when I felt truer to my calling, felt truer to the people who were listening to me. But it also just was like, oh, okay, yeah. Well, that scientifically doesn't make any sense.
Yeah.
Here's what we didn't do. When we said, hey, kids don't get it, and we found out that they did, we didn't get in front of the American people and say, we made a miscalculation. The reason why we thought kids didn't get it was 1, 2, and 3. Now we know 4, 5, and 6. And because we know 4, 5, and 6, now we're going to be helping the children do 6, 7, 8, or 7, 8, 9. Nobody did that. Nobody. So when you say, hey, you can't get the virus when you go outdoors, and then the Rose Garden happened when they were,
people got sick.
All of the high post folks got it. Then you didn't come up and say, well, we said that you couldn't get it up, right? When we said, hey, it's only on surfaces, what we call fomites.
They messed up like 5,000 times, Doc.
And we didn't come back and say, hey, listen, we thought it was fomites because that's what the science before told us. Now we know that not only is it aerosolized, that thing is just airborne. It's flying across stuff. If we had done that, if we had taken back the narrative and said, here's what we have learned. Nobody knew about COVID-19 because it was new for everybody.
Right.
Then you know how many hundreds of thousands or even millions of people would have been like, oh, thank you. Now I understand. You're not trying to mislead me. You just didn't know you made a mistake. And I'm telling you right now, as much as I wish that I could say I was trained to say I made a mistake as a physician, I was not. And that's ingrained in us. That's in our DNA. It's too bad.
With that in mind, and thank you for your transparency with that as well.
Yeah.
Do you stand by the COVID-19 vaccine? in light of everything that you've learned, do you still think it's the best decision for those of us who want to take those measures to curb potential symptoms or what have you if we get COVID?
Yeah, this always sounds trite, but no one size fits all. I think that the original vaccines did a lot of good for a lot of people. I am uncertain about the current bivalent vaccines, especially the current one that's available now. Remember, the newest one has not been released yet. And I'm not really sure that it is necessary for the wider population, but I don't have anything to base that on.
Right.
So I can tell you that's what my leaning is. That's what my kind of scientific sixth sense is saying, but I can't say why. Right? Again, I don't have data that says, oh yeah. I can tell you in my experience here in my clinic, when I see people who have gotten it and there's not a reason for them to have had an adverse event or consequence, I'm scratching my head. This person had the full 3-shot series. They had a booster. Right?
Yeah.
Why would they have a problem here? So there are some people who with the current bivalent vaccine that I am asking them to take it. Okay. Those are people who, if they get COVID-19, that they would do really poorly. People are dying today. Right now, somebody is dying from COVID-19, even the variants that we have now that we think are less deadly. And so there is a place for it, and there are people who should take it. And here's the problem. If you don't have somebody to counsel you on that, then you're left to your own devices.
Yeah.
You wouldn't make that kind of decision about your taxes. Like, you're going to get an account.
Right.
Why would you make that decision about your life? Like your body? You only get one of these boys.
Yeah, for sure.
Figure out how to give me another one, and then you are richer than Jeff Bezos. So go get somebody who can counsel you. What does that mean? Does that mean a doctor? Well, there's some people who, I don't like doctors. Remember, they have something that happened to them or somebody in their family why they don't like doctors. But find somebody who can give you the advice that knows how to navigate the information. Get you a healthcare provider right now, because this is the only body you have, and you should have a health strategy. You should have a process by which you say, here's how I'm going to live for a long time. And in order for me to live a long time, I'm going to avoid some of the preventable diseases, one of which is COVID-19.
It's COVID. I want to double up on this question. Let's talk about avoidance.
Yeah.
And then I want to move a little bit into immunity defense.
Yeah.
I know we kind of, before the camera started rolling, Dr. Dave was telling me about some people may be predisposed to have harsher symptoms. Some people may be predisposed to not even experience COVID at all.
That's
so I'm a big vitamin girl.
Yeah.
I'm really big on vitamins.
Yeah.
Your thoughts around how those help in immunity defense, and also just in terms of the predisposition, how the landscape of that is looking based on the research that you've done.
Yeah, I mean, I think this doesn't go, it's not a lot of debate around that there are some vitamins and nutrients that we can take in that boost our immune system, right? We know the big ones, they really became popular in COVID-19. I think that almost everybody should take some kind of vitamin D supplement, especially people of color, darker, Latins, Africans, right? We should take vitamin D.
Yeah.
I'm not saying that if you are not in those groups that you shouldn't, but I just the science shows if we take the average vitamin D level of African Americans, let's say, it's going to be lower than other people. We should have vitamin D. Why? Vitamin D has been said to be what we call a cofactor of about a third of your genes.
Wow.
A third of your gene products, like what the genes do? Are you kidding? So if I have a vitamin D deficiency, all kinds of stuff cannot be optimally functioning, and I don't really know it.
Yeah.
Vitamin D. Zinc is there. Vitamin C. People know these things. And so I think that there is a place for that. But what if we're not in a place where we could say vitamin D, zinc, and vitamin C, well, that prevents us from getting COVID-19. I wish that were the case. We wouldn't be talking about COVID-19.
Yeah.
We'd be talking about something else. Immunity. We are still trying to figure out how long your immunity lasts. How long your immunity lasts after being infected, right? And my fear when COVID first came out for people who said, I'm not getting a vaccine, was that they would get infected and have a bad way to go, and many people did. In fact, unfortunately, we were reporting on people who did the poorest. The people who did the poorest were people who did not get their vaccine. And it caused a lot of trouble. But the other side of that is that there is about a third of people roughly, this is an estimate, obviously, because you can't know, a third of people who get no symptoms whatsoever, fully infected with COVID-19, but have no idea. That's what fueled the pandemic the way it did. Because I'm sitting in front of you. There's no symptom.
Yeah.
I'm not just not being honest.
Right.
I don't have a symptom. There's research now that says there's an HLA. We've got a bunch of 3-letter little words around this. There's a part of your immune system and the way cells function that protect people from getting even symptoms. In other words, it doesn't even let COVID into cells. If the virus can't get into your cells, it can't do anything.
Wow.
So there are some people who are protected in that way. But there, to your point, are people who have a different set of biological variations that predispose them to worse outcomes from COVID-19. Now, unfortunately, that's not commercially available. You kind of do a little nasal thing and see if you have
That's
it.
what I'm thinking. Like, is there a test available for people to know? Like, am I predisposed to not deal with COVID in this way from a symptomatic standpoint? Am I more at risk? I mean, is there some level of testing?
But shouldn't that be where we're going? And really, the people who know about this, I mean, they're ahead of the game, right? So, there's a whole lot of machine learning and AI around kind of how do we make that available?
Yeah.
How do we tweeze out who is going to do poorly from things like COVID-19? So if somebody's working on it, I'm absolutely sure of it. It's not really readily available, or else it wouldn't be news. We'd be talking about it. But yeah, that's there. And so if it were that we could get COVID one time and be good, we'd have a different virus.
Absolutely.
If it were good, if it were true that you could get polio nobody wants to get polio. You don't want to see how your body would respond to some of these viruses.
Yeah.
So that question to me is an unsavory question to answer. I think that people should weigh the pros and cons of being vaccinated against real data about themselves. Mm-hmm. Not, hey, I'm healthy, I'm strong, I go to the gym every day, I eat a vegan diet, but you got this HLA over here, right? You can't know that. You can't know that without going to kind of see physicians. I just want people to be vigorous in assumptions that they make that have to do with their health.
Yeah, yeah.
You only get one of these. Vigorous about the assumptions that you make and be real with yourself and upfront with yourself. I'm just afraid of the vaccine. Just say it. I'm afraid of the vaccine. Well, why? Because I saw this person over here. I saw this person over here. Yeah. None of which are genetically related. Like, you don't have any bloodlines to these people, but I get it. And I'm not trying to, I'm not casting aspersions, so it might have sounded like that, so I take that back. But rigorous means that I don't just take something that happened to somebody else and make an assumption about myself. I also want you to have a strategy, and I talked about this before, because if you're not going to do the vaccine, that's a part of your strategy.
Right.
I'm never going to do a vaccine. Well, then what is my strategy not to suffer from the variants that are to come? What am I going to do? You cannot say that I just am virile and strong and I won't be, affected by it. Right. Because we haven't done that test on you yet. And there are scientists trying to figure that out. Yeah. But you haven't had that test, I'm almost willing to bet. And if you have a strategy, like, for example, part of my strategy is I still wear a mask in the office. I wear a mask on every plane. Yeah. I'm not trying to look cute on a plane. I'm married. Like, I am.
You ain't on the hunt, Dr. Dave.
I'm good.
You're already taken.
You don't have to know what I look like. In fact, I look younger when I put on a mask. Okay? I'm usually traveling with my wife. She's got on a mask. We kissing through the mask. You see what I'm saying? Like, give me a good reason. Because I was talking to a patient about this. I said, there are 250 people on a plane.
I put a mask on too, Doc. I can't risk that.
Ask yourself the question.
Let me tell you something, Doc. People get on the plane to cough. I'm convinced people go to the movies to cough. They get on the plane to cough. They get on the train to cough. They get on the bus to cough. They literally say, "Oh, I'm ready to cough."
They wait till they get
on the plane. Take a trip.
That's right.
I'm dead serious.
The whole lung out.
It's crazy.
In the aisle.
It's insane.
Yeah.
I'm not risking that.
Yeah, it's not right. And how do you know that's not COVID? Oh, no, it's allergies. Okay, bruh.
Yeah, because that's everybody's little excuse.
Right. That's right. So, I think there's a lot of that. I always tell people kind of have some tests at your home.
Yeah.
Because when if you feel like you might have it or something seems like it's off, you don't want to have to run to Walgreens, right? At 11 o'clock at night. And my simple thing was have one test per individual in your family and just have that around and refresh them as necessary. And then what's a plan if somebody in our family gets it? Like somebody in this household gets it, where are they going to stay? Because we still should isolate. You still don't want to pass it around.
Yeah, for sure.
Where they're going to isolate, what's our, strategy for giving them food and making sure they can go take a shower and bath, whatever it is, and sit down and have a conversation with the people in your home. Mm-hmm. You want to protect your home by having a strategy for you and your family. And I think that's important.
Speaking of strategy, before I got the vaccine, in part, I had a conversation with my physician, my primary care doctor, obviously you. We talked about it at length. I came in and got my physical done. I had a heart CT because I have heart disease on my mom's side, on the men's side of my mom's side of the family. So I went through the whole process before I finally said, okay, I'm going to go get it.
Yeah.
There are people that say, like you said or alluded to earlier, oh, such and such got the vaccine and then they died, or then they got this and then they got that. Do you think sometimes there are people that have adverse reactions to the vaccination? Absolutely. In part because they maybe didn't get those checks done. They just kind of got them. And I know when I was talking about getting the vaccine, you said, hey, Sharí, there are some people that I told you can't get this. Yeah. You can't get the vaccine because you're at risk in other areas.
Yeah. 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 And there are some people who I say, do not go get the vaccine. Yeah. There are some people who I say that to. I do think that some people who have died after the vaccine died from a complication of the vaccine. I do not think that we can say what percentage that is or anything like that. And there are some cases where we would just be wrong to assume that. It's not rigorous. It's not scientific to just say, he had a vaccine 3 months ago. Oh, he had a vaccine last year and then died the next. What? Wait. And unfortunately, we don't have one test, like a post-mortem test to say, oh, this person died from, COVID-19. The people who are in extremis from COVID have an active infection, let's say, or have myocarditis, fulminant myocarditis, so they're really sick and you can kind of do some of the tests. But people who have a stance against vaccines will turn the vaccine argument on anything. And I understand why. Again, you're feeling that person. Why, right? They'll tell you of some harrowing story in their family of why that is. And it's really important for us to listen to that. So some people have been harmed by the vaccine. I just don't know how we can be rigorous and say, this is how many. You know what I'm saying? Scientifically, this is how many. That
makes sense. I want to talk about long COVID because I promised my brother Otis that I would talk to you about this. He got COVID, I believe, fall of 2020. He wasn't vaccinated at the time. And I'm thinking about the timeline. It wasn't even available at that time when he got it, I don't believe. And he said, Sharí, I haven't felt the same. I'm good, but I haven't felt like myself. Fully since I got COVID. What say you to the realities around long COVID? Do you feel like there should be more conversation around it? I feel like there's a lot of people out here that are dealing with some real things as it relates to that aren't necessarily kind of seen or heard.
Yeah, not only seen or heard, or themselves may not even be making the connection. And so there are a lot of people who come in and we're like, why are you feeling like this? And I see a certain pattern. So we've started to see these patterns in the post-COVID, what people are calling long COVID or long hauler. We see patterns and we've ruled out all the other stuff and we ask questions around the COVID experience. And again, I don't have a test that says, boom, positive for long hauler, negative for long hauler. But we know it's a true phenomenon. And our bodies, humans are more alike than we are different. So our bodies are starting to act the same or act in similar ways when we have long COVID. So when I get that constellation of symptoms, for example, you may have heard people talking about POTS. POTS is a situation where your heart rate races just when you stand up. You change your position. You're lying down, you sit up, heart races. You stand up, heart races. You're like, what's going on? My heart never raced before. I'm an athlete. These are some of the changes that happen. It's not the only one, but it's an example for people to understand. What the science shows now is your immune system is a really great patrolling military, and they're factions of the immune system. Some of their job is just to patrol the streets. Be in these streets trying to figure out if there is a clown out here trying to harm us. And it's that faction of your white blood cells that is saying, I'm telling y'all, I know y'all think I'm crazy. I'm telling y'all, he's still here. And lo and behold, they do biopsy and they found that one of the places that the virus harbors itself is in the intestine.
Wow.
This is real biopsy. You can see, look, that's it. There's the virus right there. So the immune system was like, I told you. I told you. And that's why I call my boys. The immune system's still red hot from that. And the long hauler, at least in part, the response of your body to your immune system still on fire.
Yeah.
And so we're still understanding, how do you get it out altogether? Yeah. I mean, the virus is cunning. Like, how did it figure out, let me go hide under the deepest rock?
That's so crazy.
The intelligence of this thing, but that is one of the examples that scientists every day are trying to help us figure out. And I also say the scientists who are trying to save our lives on the front of vaccines, on the front of medicines, those people are not trying to hoodwink you. They're like, what are you talking about? I'm just trying to make a gigantic impact on society by not letting us die from a virus. And here's what my research tells us. But guess whose fault is it that we don't tell that message? Because if I say that message to a large, population of people, just like I just said, but give you what I'm working on, you'd be like, damn, that's pretty good.
It eases the angst immediately.
I roll with you.
Right.
I roll with this.
We don't got nobody to roll with, Dr. Dave, because nobody's telling us.
That's the problem. That's why I'm not going to stop. I got a lot of no's. I've heard a lot of no's. No, we don't. No, we're not going to do a show. No, you're not going to do a segment. No, you're not going to. Listen, I will be 89 years old before I give up saying that America needs somebody that they can look on for information like this and believe that they're going to tell them the truth. The truth changes. Believe that when the truth changes, you say, I'm sorry, I made a mistake. Here's what we know.
Yeah.
The PR disaster that we have has to go away. It's no longer enough for us to be able to say, we're just not that good at it anymore.
Right.
We have a PR problem and it's got to go away. And I think the messenger matters. I think I'm that messenger. I think that I'm a part of that messenger crew. And boy, until we can speak to people straight in and stop, talking to people and start letting people feel what you're saying, we're going to have the same thing. And the whole earth was on fire because we missed an opportunity to go straight in, to shoot from the hip, but come from the heart.
Absolutely.
I tell you the truth, it's going to hurt a little bit, but you know where I'm coming from. So,
speaking of that, as we kind of close this out, we're in the fall season.
Yeah.
COVID's still here, RSV's around, flu is around. What can you say to those who are just, again, in need of maybe some, hey, Dr. Dave, what's some great ways I can make sure that I stay as healthy as possible as I'm kind of wading the waters of all these different things going on? What should I have my heart checked out? Is there an age range? Just kind of the basic knowledge so people can know how to kind of move through and make their health a priority.
Basic knowledge for everybody is, if I zoom all the way out, do you have a strategy for your health, period? I have a financial strategy. I have a vacation strategy. I got a relationship strategy. Folks get like, I'm planning, I'm going to be married. They have a strategy.
Yeah.
Do you have a strategy to be the healthiest human being that you can be for as long as you can be it? And guess what? High functioning people, super smart people, will say, dang, I never really thought about it like that. Go get a strategy. The general information that I can say to everybody is the way you feel your body, the way you move your body, the way you rest your body, and the way you still your body. The 4 pillars, I think, of longevity, which nobody argues with, are the right diet for the right person at the right time. One size doesn't fit all. the right exercise. Your body's not meant, we're not designed, we're not a tortoise. We don't just kind of move inches at a time. We are biped. We got 2 feet, we run, we move, right? You got to have a strategy. What's my strategy for exercise? Given my health, right? What if I have a knee problem? What if I have scoliosis? What if I have this? What is my strategy for myself? Do I sleep?
Ooh, that sleep one is huge.
I'm gonna tell you right now. It was like, oh, I'll sleep when I die. Okay, let's turn the timer on. Okay, ready? Like, are you ready? Listen, every organism on the face of the earth sleeps.
That's true.
Flowers sleep. They open it, they open back up. You think you can go on and function really well and reap the benefits of your labor and you know, the fruits of your labor and not sleep? You know, you're not seeing the back of your eyelids. That's not good. Now here's the other part. Well, what do you mean, Dr. Dave? Well, that just kind of sounds like you're kind of following it. I get it. It sounds like I'm towing the line. But ask the people who don't sleep if when they're awake, they're fully awake.
Right.
You're not awake.
They're not.
You can't even function right. You don't even know how good you can think. You don't even know how you think you're good right now. Imagine if you got 7 hours on average of sleep. Man, you would be unstoppable. Go to sleep. You are not missing anything. Like a 9-year-old, want to stay up. Go to sleep so you can function well and live for a really long time. And then the stillness part, the mindfulness part.
Yeah.
When you can have a super highway to the divine, to your answers. Some people go when they're in the shower. They say, oh, I get my best ideas in the shower. You know why? Because you're quiet. You've got this thing that puts you into a different state and you get an idea. Sometimes I can get an idea when I'm at the barber. I'm completely quiet. You know, she's doing a little thing, Oh, I got me a great idea. That's still a mindfulness. Right? If you have a strategy for mindfulness, you programmed in your mindfulness, your immune system's better, right? Your heart is better. Like all of these things. So that's universal. Like everybody who's listening to that can follow that. I didn't say everybody should go get a vaccine because everybody should not. I didn't say everybody should go, you know, take a medicine because everybody should not. You should do all your health screenings. So if you have a colon, go get it screened. If you have a heart, you should get it screened. If you have breasts, go get them screened. If you have a uterus, go get it screened. You should be doing the things that we know keep people healthy for a long time and prevent disease. The mainstay of prevention is early detection. You can't detect things early if you're at home thinking that you're the healthiest person. Even the healthiest person can have something wrong. There's nobody that has a perfect physiology. There's nobody alive that has nothing wrong with them. Did you know that? Zero. Like I have some fantasies of people who I want to be perfect, but they're not perfect. They're not perfect either. And if we just resonate around, hey, every human has an imperfection. Let me go find out what mine is so it doesn't take me out early. Boom. That's a health strategy. Go get your health strategy.
Get a health strategy and go to bed. Like Dr. Dave said.
Go to sleep.
Dr. Dave, I love you. You already know.
I love you too.
I'm so glad we got to do this. Thank you for your integrity.
Yeah.
You are a man of excellence, and I really admire you and all of the work you do. So congratulations on this beautiful practice.
Thank you. Thank you very
much. All the great
much.
things you're doing. You guys, you're gonna see Dr. Dave on the news in the next 2 seconds. Trust me, he's on the news all the time. He's on TV, and he's gonna get that show that he's talking about, and it's gonna be phenomenal. I appreciate you, Dr. Dave.
I feel that.
Thank you for being a part of season 4. Just a Thought with Sharí Nycole on
my girl,
the road.
It's just a thought. It's just a thought. Just my opinion. It's just a thought. It's just a thought. Get out your feelings. It's just a thought. It's just a